Diabetes is a chronic condition that affects millions of people worldwide, and it comes in two main types, type 1 and type 2. Both types involve issues with insulin, a hormone produced by the pancreas that regulates blood sugar levels. But the causes, symptoms, and management of these two types are quite different. Let's start with type 1 diabetes, often diagnosed in children and young adults. It's an autoimmune condition, meaning the body's immune system mistakenly attacks and destroys the insulin-producing beta cells in the pancreas. This leaves the individual with little to no insulin, leading to high blood sugar levels. Symptoms of type 1 diabetes can appear suddenly and may include excessive thirst, frequent urination, extreme fatigue, and blurred vision. If left untreated, it can lead to a life-threatening condition called diabetic ketoacidosis, where the body starts breaking down fat for energy, producing harmful acids called ketones. Now, let's shift our focus to type 2 diabetes, which is far more common and typically develops in adults, although we're seeing an alarming rise in children and adolescents. In type 2 diabetes, the body becomes resistant to insulin, meaning the insulin produced isn't effective in lowering blood sugar levels. This resistance often develops due to a combination of genetic factors and lifestyle choices, including poor diet, lack of exercise, and obesity. Symptoms may be subtle and can include increased hunger, fatigue, and dark patches of skin, especially around the neck and armpits. The treatment for type 1 diabetes is straightforward but requires lifelong management. Patients must take insulin injections or use an insulin pump to manage their blood sugar levels. They also need to monitor their blood glucose frequently and adjust their insulin doses based on their diet and activity levels. For type 2 diabetes, treatment often starts with lifestyle changes. This means adopting a balanced diet rich in whole grains, fruits, vegetables, and lean proteins while reducing processed foods and sugars. Regular exercise is crucial, as even moderate physical activity can improve insulin sensitivity. If lifestyle changes aren't enough, medications may be necessary, and in some cases, insulin therapy may also be prescribed. Prevention is particularly vital for type 2 diabetes. Maintaining a healthy weight, engaging in regular physical activity, and eating a balanced diet can significantly reduce the risk. Regular checkups with healthcare providers to monitor blood sugar levels are also important, especially for those with a family history of diabetes. Now, let's talk about the consequences of untreated diabetes. For both types, chronic high blood sugar can lead to severe complications. This includes cardiovascular disease, which can increase the risk of heart attacks and strokes. People with diabetes may also face nerve damage, known as neuropathy, which can cause pain, tingling, or loss of sensation, especially in the feet. Kidney damage, or diabetic nephropathy, can occur, leading to kidney failure and the need for dialysis. Eye problems, including diabetic retinopathy, can lead to vision loss. Poor circulation can result in foot ulcers and, in severe cases, amputations. Mental health can also be affected, with higher rates of depression and anxiety among those managing diabetes. The key takeaway is that diabetes, whether type 1 or type 2, requires awareness, early detection, and proactive management. By understanding the condition, its causes, and treatment options, individuals can lead healthy, fulfilling lives despite the challenges diabetes presents. So, if you or someone you know is at risk, don't hesitate to seek guidance from healthcare professionals. Together, we can take control of our health and combat this epidemic.